इस एडवर्ड आइलैंड की मुख्य जनतक सेहत अधिकारी डॉक्टर हीथन मॉरिसन वालों चल रही कोविड-19 महामारी बारे एक जवाब बारे एक अपडेट प्रदान की गई। डॉक्टर मॉरिसन ने कहा कि प्रोविंस नूं मुड़ खोलण की योजना ते संगठित इकट्ठा खेड समागमां कारोबारां लई समर्था सीमावां च 17 मार्च नूं ढिल दित्ती जावेगी ते नाल ही उन्हां कोविड टेस्टिंग प्रोटोकॉल च तब्दीलियां दी भी चर्चा की।
In keeping with our slow and measured approach, next week we will plan to move to step 2 of the Moving On plan. On Thursday, March 17th at 12:01 a.m., the following changes will come into effect. Personal gatherings of 20 people indoors and 50 people outdoors. Organized gatherings of up to 75% capacity with space being maximized to allow for as much physical distancing as possible. Fitness facilities, retail, museums, casinos, and libraries up to 75% capacity. Wedding receptions, funeral receptions, and stand-up receptions of up to 100 people. Organized sport and recreation activities with a maximum of 100 participants interacting over the course of a day. And universal screening at the points of entry will continue, but we will transition to random testing of people entering PEI. I expect we will be moving to the third and final step of the Moving Forward plan on or before April 7th. There will be up-to-date information posted on the website later this week regarding the changes that will come into effect next week. In PEI, we've had much better access to COVID-19 testing compared to other provinces and territories. Given we have tested more people, it is really not accurate to compare our case rates directly with other jurisdictions. We have a much better sense of what is happening in PEI with COVID-19. We have been able to connect people at high risk to therapeutic treatments and limit severe outcomes. We know where transmission is occurring based on the case data, and we have been able to link cases. All of this information is important as we manage this wave of the pandemic. However, our testing capacity is now strained. Last week, 13,000 tests were conducted at health PI clinics, or an average of 1,850 tests per day. And that was compared to an average of 1,390 tests the week previous, and an increase of over 30%. An mRNA booster offers superior protection compared to 2 doses, keeping more people out of hospital and preventing deaths. There is emerging evidence that getting a booster dose also provides protection against long COVID. As of Sunday, March 6th, 97.3% of people aged 12 and over in this province have at least 1 dose, and 94.1% have 2 doses. 69.5% of children aged 5 to 11 have 1 dose, and 41% have 2 doses. Over 40,000 people aged 12 and over are eligible for their 3rd dose and have not yet received it. But 83% of those over 50 who are eligible for booster have received their booster. I've said this before, and I will repeat it. Everyone is eligible. Everyone who is eligible should receive their booster. And we do need to continue to improve the rate of vaccination among children aged 5 to 11. And there are appointments available this week.